Our next guest is looking to end obesity with a different approach. We want to bring in Dr. Shantanu Gaur. He's Allurion Technologies founder and CEO. It's great to see you here. So before we dig into what your treatment exactly looks like, I'm curious to get your perspective on Roche buying Carmot Technologies, the increase in focus on this race for obesity drugs, how that's changed your playbook or your approach to treating obesity.
Well, it's been a great boon for our business, seeing obesity in the news every day and so much interest from investors, patients, and providers has been a breath of fresh air in the obesity space over the past decade. And I want to underscore one thing. I really do believe these medications are great tools for patients who have obesity, but they are not going to be the cure for obesity. If you think about blood pressure, high cholesterol, diabetes, we have hundreds of drugs to treat these chronic diseases, but yet they still are very, very prevalent all over the world. And the reason is many of these drugs require lifelong use, and we all know that adherence rate to medications is extremely low. Even with GLP-1s, 2/3 of patients who start a GLP-1 drug will stop within the first year. And so there's a lot of work ahead of us when it comes to medications, and I really believe that they are not going to be the single long-term cure-all for the obesity epidemic.
So do you believe that people and the broader consumer environment that has in some form or another cozied up to GLP-1s or other obesity and weight loss drugs, do you think they fully understand what they're getting into in these cases then? I mean, when you're talking about you have to continue to take this over an extended period of time, if not for life, as I believe you just mentioned a moment ago, then what type of long-term implications are we talking about? What other types of conditions could arise more broadly among the cohort that is taking on some of these drugs?
There's a series of issues here. I think the general public and patients in general don't realize that once you stop taking these drugs, the weight can come right back on. There's not enough of a focus on behavior change and lifestyle modification, and that's one thing we pride ourselves on at Allurion, combining these tools with best-in-class behavior change so people can actually change their lifestyle and actually keep this weight off in the long run. With these drugs, too, being used at higher doses than they've ever been, there's really no long-term data on what happens to patients after several years or several decades of therapy. There's already some indications that these drugs may have impacts on thyroid cancer incidence or pancreatic cancer incidence or a host of other diseases that could actually give rise to even bigger problems for patients who have obesity. So there are a lot of unknowns out there, no doubt about it. These drugs have been a great boon for many, many patients, and they've created a ton of awareness amongst millions of people around the world who are struggling with obesity, but they are not going to be the be-all, end-all in the obesity epidemic. There's going to be a requirement, really, for different sorts of therapies for different sorts of patients.
And then there's also the affordability aspect of all this. I'm curious how you're approaching this and trying to make your offering, I guess, accessible to as many people as possible.
Well, at Allurion, we don't believe that you need to be on a medication or a device or a drug for your entire life. We believe that through lifestyle modification and behavior change, you can actually keep the weight off in the long haul. And so what we've developed at Allurion is a device that you can swallow in a 15-minute office visit. It's a balloon that sits inside your stomach, helps you feel full. And that balloon disappears after 4 months. And in that 4-month period of time, we help you change your lifestyle, modify your behavior through artificial intelligence. We have something called Coach Iris, which is a 24/7 weight loss coach there to answer all of your questions that you have as you go through your weight loss journey. And we have a behavior change program, proprietary behavior change program that we've developed in-house at Allurion that's delivered through our mobile platform so that patients actually can get the type of coaching, the type of behavior change and lifestyle modification advice and counseling that they need. And our patients will lose 30 pounds of weight or 15% of their total body weight in just 4 months. It's a very fast weight loss when you have a balloon like this sitting inside your stomach helping you feel full. And they'll maintain 95% of that weight loss at 1 year. So unlike these drugs, when our balloon disappears from your stomach, it's not like the weight comes right back on. But if you're taking a GLP-1 drug, the moment you stop injecting yourself, you're going to see the weight come back with a vengeance.
Is the balloon collecting data? I'm sorry if this is a dumb question, but I mean, there's so many kind of conversations that we've continued to hear around embeddable technology and I mean, the balloon disappears, so I guess, it's limited in scope how much data it would be collecting. But is there kind of a collection that takes place on top of that is allowing people to have kind of better example of their biometrics? Can you just kind of explain how this works?
Yeah, we're collecting actually a lot of useful data that our providers and patients find incredibly valuable. Every patient who gets our balloon gets our Bluetooth scale. They get our health tracker smartwatch. If they have their own wearables like an Apple Watch or a Fitbit, that works with our platform too. And so we're able to track patients' weight, their activity, their exercise, their sleep, and monitor all of that as they go through their weight loss journey. We make that data available to the provider who actually gave them the balloon, so that provider can actually track those patients in real time and intervene if there are any issues as the patient goes through their weight loss journey. And on top of all of that data, we have a very powerful suite of machine learning algorithms and an AI platform that's constantly combing through the data, looking for patients who might not be on track for success. One of our machine learning algorithms can actually predict within the first 20 days of someone getting our balloon what their 4-month outcome is going to look like. And so the data that we've collected is incredibly powerful. As of now, the balloon is not collecting any data or transmitting anything back to the app, but TBD, and stay tuned on that front.
All right, watch out, grapes market. Here comes the balloon. Dr. Shantanu Gaur, who is the Allurion Technologies founder and CEO. Thanks so much for joining us here this morning. Appreciate it.
Thank you for having me.